Good evening, and thank you for joining us. For those of you who may not know me, my name is Sam Adams Lanham. I'm the Community Engagement Librarian at the Barrington Area Library. So that means I work alongside and for the benefit of our local nonprofits. So tonight's program is done in collaboration with Advocate Good Shepherd Hospital, and specifically Keely Gallagher from the hospital. She's going to introduce our other partners. Keely is a master's in public health and is the, I'm going to get it wrong, community health coordinator. Is that correct? Okay.
Yeah.
At Advocate Good Shepherd. If you are joining us, if you are watching recording later, we will be answering questions at the end for the folks who are present. So hopefully if your questions weren't addressed, watch all the way to the end and hopefully we'll get to them. But you can also email either myself or Keely, and we can try and get you in touch with the researchers as well if you have further questions. So with that, Keely, if you would like to take one.
Hi, my name is Keely Gallagher, and I'm the Community Health Coordinator at Advocate Good Shepherd, as Sam said. And I will be introducing the Barrington Area Community Study tonight. It's hard to believe, but the community study has actually been going on for over 20 years now. And Jeannie Ong and myself, who is the director over at Good Shepherd, have gotten to be part of the last 3, I believe. And we did work with the research team during those. And the purpose of this study is for the community leaders and the stakeholders in Barrington to better understand the health needs, issues, and any barriers to health in the Barrington community. The survey does have both qualitative data from the focus groups and quantitative data from the focus groups and qualitative data from the demographics and the survey data. I will now go ahead and introduce our U of I College of Medicine of Rockford team, and I'll hand it over to you, Manu.
Thank you, Keely. Hi, everyone. Good evening. My name is Dr. Manu Khare. I'm a faculty at the University of Illinois College of Medicine at Rockford, and I head the Division of Health Research and Evaluation within the Department of Family Community Medicine. We are a research division that does a lot of community-based research. This study was had so many different parts. We had a large team working on it. And when I start the presentation, I will talk about our team members. But on the presentation today is Christine Denhausen-Brunn, who also assisted with this effort. She mostly oversaw the whole analysis and report writing for the community survey and assisted with the focus groups. Christine, you want to say a couple words and then I'll start the presentation after that.
I also helped with finalizing the final survey and getting that programmed, and I'm a senior research specialist with I have my master's in public health, and it's a pleasure to be here with you tonight and share some of the information that we found from your community. We hope it's helpful.
Yes. Okay, so I will share screen. And as Keely mentioned, I would just say, if you have questions as we are talking, please put them in the chat. We will try to address as many questions as possible towards the end. So with that, I'm going to share the screen, share my screen.
It's in presenter view.
Yes. Is that good?
Go. Yep. Now
That takes a second. Okay, so we are here to present the findings from the Healthier Barrington study. And what we will talk about today is the community residents survey that was done, focus groups that were conducted with the community residents, as well as business leaders, and a not-for-profit survey, which was a new component of this study this time. As I said earlier, I am an associate professor in the College of Medicine. I have a PhD in public health and a master's degree in preventive medicine, and do population-based, community-based research. Christine just introduced herself. She was another team member. In addition, we had Dr. Kara Allen, who ran the not-for-profit survey. She's unable to be here this evening, but she did all of that analysis. And then we had a research associate, Tasneem Fatima. We also had an undergrad student intern, Mason Hoffman from Beloit College, who was part of this team. As a teaching institution, we use all of our projects as ways to teach students how to do research and what to do. And then I have to mention two other people who have not listed here. We did a focus group in Spanish, and we also had a translation of the survey. And so we had a researcher from UIC Chicago, Dr. Mariana Torres Garcia, who ran the focus groups and assisted with a little bit of the translation, and another research associate, Carolina Rojas Becerra, who did assist with the Spanish focus group. Okay, now I will move on to actual findings. So in today's presentation, I'll give you an overview of the project. We'll talk about the community resident survey, the focus groups, and the not-for-profit survey. As Keely mentioned, this Healthier Barrington study is being done since 1996, and our division of research has been doing it for almost, I think, 8 of those 9 times. So we have a lot of history doing these studies for the Barrington area. The goals of this study to understand the overall health of residents in Barrington, health defined broadly as physical, mental, and behavioral health, to identify community values, priorities, and perceptions, to identify gaps and unmet needs, to understand the economic conditions, to understand environmental concerns, and then, of course, to understand the impact of COVID-19 on the health of Barrington area residents, as well as the not-for-profits in the area. So talking about methodology for the community residents survey was done both on paper as well as on the internet. It was done in English and Spanish. It was available in English and Spanish. It is a convenient sample of Barrington area community residents. So people who chose to respond responded. 12 sections, and it took an average of about 28 minutes to complete. The respondents to the survey are the individuals, so the questions were not about households, it was about individuals. Survey was live from January 25th to April 1st, and we provided incentives for the community resident survey. We did a drawing and provided $25 gift cards that were donated by local Barrington area businesses. The focus groups, we created the survey, the questions for the focus group by working with the Healthier Barrington Coalition. We did 2 community resident focus groups, one in English and one in Spanish, and a business leader focus group that was new this year. The focus groups were conducted in end of March, early and April. And again, incentives were provided for the community resident focus groups that were also donated by Barrington area businesses. The not-for-profit survey was new this year, and the goal was to get a sense of how not-for-profits were impacted by the COVID-19 pandemic. So getting down to the survey now, a total of 659 surveys was our total sample size when we analyzed the data. 903 individuals actually accessed the survey, but a chunk of them, 229, did not answer any questions or answer just one question. And so we had to throw out those cases. 15 were determined to be spam because we could figure that out by just, the timestamp on it and IP addresses, etc. There may have been more than one respondent from a household, and there's no way for us to control for that. Of the 659, only 8 were completed on paper, even though we did, Keely and Jeannie and our partners did go out of the way to try to provide paper copies in several locations. So respondent characteristics, 63% of our respondents were 45 years or older. We had about 32% that were between 30 and 44 years. And so you see that there were mostly older people responding to the survey. Majority were female, 69%, which is not uncommon in this kind of research. In terms of race ethnicity, 78% were white, and then you have small distribution of other races. but individuals could check more than one category. So we had 3% who chose 2 categories and 1% that chose 3 categories. In terms of respondent location, 35% of the respondents lived in Barrington, followed by 12% each in Barrington Hills and South Barrington, 9% in Lake Barrington, 7% North Barrington, and the rest of the towns are really small percentages. Length of time respondent lived in the Barrington area. You had 52% who had lived in Barrington for more than 20 years. 19% that have lived in the area for 11 to 20 years. So clearly people love Barrington, they stay over time. We asked the question about why they chose to live in Barrington, and 66%, so a majority said they lived there because of the natural resources and open space and the good schools. This again was a check all that apply question, and so the percentages are not going to add up to 100. Safe neighborhoods, family, and proximity to Chicago were the subsequent options that people chose. We asked the question about where they look for local information, and we asked them to check everything that applied. 55% go to social media, 49% to websites, 48% e-newsletters, 40% direct mail newsletters, and then it goes down from there. So social media was the primary source of local information. So the next section was about household finances, and we asked the question about how many households had difficulty paying housing expenses. 18% said they had difficulty paying housing expenses. In 2017, when we did this study, it was 13%. Similarly, when we asked about difficulty paying other expenses besides housing, 19% said they had difficulty and 17% had difficulty in 2017. So it has gone up a little bit in both categories. We asked about resources that the household was unable to obtain in the past year. Again, keeping in mind the context of COVID, and the 2 top choices were medicines and healthcare and utilities assistance. So these were the 2 resources that households had difficulty paying. We asked about how many households had utilities shut off in the past year, and 64% said yes, of those who responded to this question. So that's a high proportion of people who said their utilities were cut off. We also asked about housing at the time of the survey. So 9% at the time of responding to the survey did not have housing, but 15% were worried about losing housing. So this is something to sort of pay attention to. We talked about how whether lack of public transportation restricted their ability to do activities of daily living. And 19% said that it limits their ability to go to work. 17% said it limits their ability to go to healthcare appointments, and 15% each said grocery shopping and other activities of daily living. Moving on to employment. Current employment status, about half were employed full-time, 27% of the respondents were retired, and 16% were employed part-time. We asked about those who were currently working from home, and 49% said they were currently working full-time from home, and 22% said yes, part-time. To give it context, the other question we asked was whether they had worked from home prior to COVID, and only 38% said they had worked at home prior to COVID. We then asked that if they were not working at home, could that work be done from home? And a little over a quarter, 26%, said yes, they could do their work from home. So to look at the impact of COVID on preferred workplace, we asked what their preferred workplace choice would be after COVID-19 restrictions were lifted. And 40% wanted the hybrid. So they want a mixture of being able to go to the office as well as work from home. 35% wanted to continue working from home, and 25% wanted to go back to work. Expected living arrangements after retirement, 32% said they would continue to live where they currently live after retirement. About 18% said they would live part of the year over here and part of the year somewhere else. 17% said they would move out of the area, and then you have other options at a lower percentage. I will now hand it over to Christine.
Hello, our next section focused on healthcare. We asked people about those in their household who were not covered by insurance. 90% of people said no one was not covered by insurance, but 7% said one person, and 2 or more people was at 3%. In 2000, this is almost double what the numbers were in 2017, when one person not being covered was at 2.9% and 2 or more was at 1.1%. We also asked about the ages of the household members not covered by insurance. Full one third of those not covered are school-age children, 6 to 15 years old, are not covered by insurance. Next, we asked about why there was a lack of insurance. The top 2 reasons given were people felt they didn't get sick, or that they didn't need insurance, or that the premiums were too high. Then we asked about delaying healthcare in the past year. We asked about dental care, other healthcare services, which pretty much covered everything besides dental care, buying or taking prescription meds, and then behavioral or mental health care services. Within that, we asked, did you delay it due to COVID, due to costs, or availability? For behavioral and mental health care services, equally, 13% delayed it due to availability, 13% delayed it due to COVID, and then 12% delayed it due to costs. When you looked at other impacts of COVID, 24% delayed other healthcare services and 24% delayed dental care, both due to COVID. Next, we looked at caregiving needs, and we looked at individuals who had a special need. 29% of 613 respondents are caregivers for someone with special needs. This is an increase from 20% in 2017. And of those caring for someone with special needs, a full 54% are caring for those people in their own home. Then we asked why that person needs a caregiver. The majority, 56%, that said that person who needed additional special caregiving needs was an older adult. And this number reflects almost identical to what it was in 2017 at also 56%. Next slide. We then looked at respite care needed and which types of respite care would your household benefit from. The top 3 categories were, with a third of respondents equally saying help with housework, affordable respite care, and day programs were the things that people needed. Next, we looked at services needed by the respondent or individuals greater than 65 years old. The top category needed was help with benefits programs, and this is similar to what it was in 2017. This year, it was 32% needing it. In 2017, only a quarter of the prop group needed help with benefit programs, so that number is rising. We then asked about types of reliable assistance needed, and we added a couple of categories here. Doing heavy housework and yard work was one of the categories listed, and this is the top category of where help was needed at 13%. Next. We looked at behavioral and mental health services. We know that this was a major issue in a lot of communities during COVID. We looked at abuse situations experienced by a household member in the past year. We looked at sexual, financial, physical, and emotional abuse. Emotional abuse was the top category mentioned at 10%, but financial abuse was not far behind at 9%. Then we looked at the change over time of situations for anyone in the household in terms of the experience of abuse experienced in the last year. And as you can see, emotional, financial, physical, and sexual all are trending upward with a significant jump in 2022, or not a significant jump. We didn't look at significance, but the trend is much higher as we hit 2022 across all 4 categories. Next slide. We looked at loneliness and isolation and the frequency with which people felt this loneliness and isolation. 34% said they never felt it. 28% said they rarely felt it. 31% said sometimes. 4% said fairly often. And 3% said experienced it frequently. We did not ask if this was a change from pre-COVID experiences. We then asked whether people were thinking about seeking help versus whether they actually did seek help for problems around mental health, alcohol, and drug abuse. The darker blue line is the yes. 39% had thought about seeking help for mental health problems, 9% had thought about alcohol, and 8% had thought about seeking help for drug abuse. Then we asked, did they actually seek that help? 31% had sought it for mental health problems, 8% for alcohol, and 10% for drug abuse. And you'll see that the biggest missing area of thinking about it to seeking it is in the mental health area. The reasons that people did not seek help. We asked to let them check as many as they wanted. The number one reason given was they could not get an appointment soon enough, followed closely by financial concerns over cost of care or not knowing where to go to get help. We asked people in the past year, has the respondent or a member of the household considered or made plans for suicide? The blue is this year, 9% had considered it or made plans, compared to 5% in 2017, the green bar. We asked the most frequent indicated age of individuals who had considered suicide. 55% of those who considered suicide were between 30 and 44 years old in 2022, and this is up from 40% in this age group in 2017. We asked about stress and how stressed are you? 17% said not at all, 35% a little bit, 26% somewhat, 15% quite a bit, 6% said very much, and 1% chose not to answer this question. Next, we looked at health behaviors and the behaviors that can help you prevent an illness. We looked at the days per week engaged in moderate to strenuous exercise. This might be brisk walk, bike, a heavier duty bike ride. People said 20% of respondents do this 3 days a week. And then we asked on average, how many minutes per week do you engage in moderate to strenuous exercise? 31% said they engaged in it 30 to 40 minutes. We know that the CDC recommends adults engage in some type of exercise for 150 plus minutes. So there's a lot of room to grow there in the amount of exercise that people are achieving in a given week. We looked at tobacco use and how many times in the past 12 months have you used tobacco? 78% said never, but 9% said once or twice, 3% said monthly, 3% said weekly, and 6% said they are using tobacco products daily or almost daily. Next, we looked at alcohol use. How often do you have a drink containing alcohol? 26% of respondents said they do this 2 to 4 times per month. And then we asked if you've increased how much you drink since March of 2020, which is the beginning of the pandemic. That's the 21% stated yes, they have increased how much they drink. 6% said they increased how much they drink, but have since stopped. And those are 2 different categories. We looked at prescription and illegal drug use. 6% are using prescription drugs for non-medical reasons monthly. 12% have done it once or twice. 2% are using prescription drugs weekly. The use of prescription drugs can be a precursor to using illegal drugs. So we asked about illegal drugs. 7% have used illegal drugs once or twice, whereas 4% are using illegal drugs monthly and 1% are using them weekly. We looked at health literacy issues, which can help you help you understand your illness better. We asked people, do they need help reading health-related materials? 16% said sometimes, 13% said very often, and 4% said they always need help. And then we asked if they understand what is said to them about their medical problem. 16% said sometimes they understand it, 7% said very often, 25% said they rarely understand what is said about their medical problem. Next, we looked at youth. First, we asked how many people have someone under 18 in their household, and 42% of respondents had someone under 18. We looked at the top issues for youth in 2022 and 2017. Anxiety, depression, and bullying were the top three across both groups. But then in 2022, pressure to succeed in learning disabilities overtook being overscheduled and ADD and ADHD. We then looked at across all the issues. The number one issue in 2022 was anxiety and nervousness for people under 18 in the household. Depression came in at 23%, with the excessive pressure to succeed at 19%. We looked at respondents' perception of the frequency of unsupervised parties where young people have access to alcohol or drugs. 31% think this happens sometimes, and 27% think it happens often. 12% think it happens all the time. 82% of respondents think parents should be held accountable for underage alcohol consumption on their property. And this is a change from 2017 when it was 90%. And then the green numbers overlaying the chart are what the numbers were in 2017 for each category. So it's shifted from people now thinking more sometimes as opposed to more often. Next slide. We looked at the impacts of COVID-19. This is definitely a new section of the survey. And keep in mind that this survey was done from the end of January through April of 2022, right as the Omicron surge was occurring in Illinois. We asked people who they trust for COVID-19 guidelines and information. Their healthcare provider overwhelmingly was the number one person they trusted at 63%, followed closely by CDC scientists and researchers at 55%, and then friends and family. We looked at shopping and COVID-19 and how things shifted. This is general online shopping prior to COVID-19 pandemic. 62% did some of their shopping online. As the pandemic occurred, that shifted to 40% doing some of it online and 45% doing most, but not all of their shopping online, and a full 8% doing all of their shopping online. We looked at online grocery shopping as well. The blue lines are before COVID-19, with 66% saying none at all of their shopping was done online. Once the pandemic occurred, it shifted to 34% doing some of it, 22% doing most, but not all of their grocery shopping online, and 5% doing all of their grocery shopping online. Next, we looked at the environment. This is a deeper dive than has been done in previous surveys. We asked people if they'd considered purchasing an electric vehicle. 47% had considered it, 5% are currently doing it. And we asked if they considered adding solar panels to their home. 31% had considered it, and 3% have done it. This survey was conducted before the passage of the Federal Inflation Reduction Act, which will incentivize electric vehicle purchases and adding solar panels. So this may create a much bigger shift in those two categories going into future surveys. We looked at rain barrel use and energy use. 22% had considered adding rain barrels and 9% have done it. And then when we looked at changing electrical systems, this might be doing a programmable thermostat or adding LED lights to your home. 47% have considered doing these things and 15% have done it. We asked about changing your landscaping to help the environment, and this might be removing invasive species, adding a rain garden, adding more native plants to your yard, planting a tree. 31% have considered doing this, and 11% are doing it. And then 30% have considered composting their food waste, and 13% do it already. We looked at what people think the local government is doing as it comes to severe weather events and protecting open spaces. 19% do not think the local government is doing enough to prepare for severe weather events. 40% think they do, and 42% are not sure. When we asked about protecting open natural spaces, 80% said the local government should do that. We asked some qualitative questions as well. The top 3 themes that emerged from 82 written responses about what the local government needs to do to better prepare for severe weather included improving communication and education, improving plowing and snow removal, and improving infrastructure. We looked at water knowledge and where respondents believe their local water comes from. 45% said deep aquifers, 28% shallow aquifers, and 13% said Lake Michigan, with 15% saying they're not sure. Then we looked at their concern for Barrington area clean water supply, and 46% are concerned about whether Barrington will have enough clean water. Where people believe they get their local water is almost similar to what it was in 2017, where it was 47% deep aquifers, 38% shallow aquifers, and 15% Lake Michigan. The shallow aquifers number has gone down, and we don't know where that group has shifted to, but the I'm not sure has increased. So the knowledge of where your water comes from has not shifted very much, except for going away from that shallow aquifer group. In 2017, 55% of respondents were concerned whether there was enough clean water supply. So that number has gone down. Next, we looked at issues in the Barrington area and people's perspectives on what the major, minor issues were. As you can see here, age-related concerns, intolerance of differing viewpoints, and mental health were the top issues in 2022. And then on the minor issues, crime, traffic control, and transportation options, or I apologize. Age-related concerns, intolerance of differing viewpoints, and mental health were the top concerns in 2022. The minor issues were crime, traffic control, and transportation options. And then in 2017, the top issues were traffic control, substance abuse, and property tax equity. So there's been a complete shift of what people think are the major issues right now. We looked at the top 5 major issues by area. In the village of Barrington, it was age-related concerns, intolerance of differing viewpoints, mental health, traffic control, and suicide prevention. Barrington area north was identical. And then when you looked at Barrington area south, property tax equity rose in, and racial and ethnic discrimination pushed out the differing viewpoints and the suicide prevention. Next. We then looked at top 5 major issues by age category. And as you can see here, the differences occurred in the youngest group being more concerned about substance abuse in the youth. The older group, 65 and older, were more concerned with transportation options and traffic control. The 45 to 64-year-olds they mirrored a little bit of the younger age group and mirrored a little bit of the older age group. We looked at adequate support services across needing more educational programs, needing more support activities, and needing more support services across all these age groups. Young children, parents and families, and children with special needs need more educational programs. Teens and young adults need more support activities, roughly 40% stating that. And then those needing more support services are children with special needs and adults with special needs. And I'm going to turn it back over to Manu.
Thank you, Christine. We'll move on to the next piece of the Healthier Barrington study, which was focus groups that we did with the community residents. We developed a semi-structured focus group guide, and I said earlier in my introduction, the focus group guide was developed with input from the Barrington Coalition. Focus groups were conducted by trained focus group moderators. We had a trained fluent Spanish-speaking moderator who did the Spanish focus group. We did a total of 3 focus groups, the 2 community resident focus groups and 1 business leader focus group. The recruitment was done through local agencies of the Healthier Barrington Coalition. We obtained consent from each of the participants in the focus group, and the discussions were recorded, sent to an outside agency for transcription, and then 2 researchers read the transcripts, identified themes, and summarized the findings. So the community resident focus group, these are the themes and the questions. So we asked about significant health issues for youth and for elderly, the impact of COVID, where they went for information, what resources they feel are needed in the community, and what they worry most about the future. So the issues raised by the community resident focus groups, right? Anxiety, mental health issues, isolation, effect on youth, lack of activities, importance of physical mental health, social connections, how children had to learn when in schools when everything was virtual, differences in opinions, political and not political. This was a new theme that arose. We have not seen this before, but this has come up over and over again in the focus groups as well as in other discussions. And desire for information to be accessible and credible, but each group identified different ways of obtaining that information, which I'll get into in just a little bit. What is in green here is a quote from one of the English focus group participants that talked about how people don't have an attitude of acceptance in the community, and it creates a significant mental health problem. Those things that you do in life that people don't accept of you, and that has a mental health impact, is what this individual said. So going on to the issues that were mentioned, I'm comparing the issues that were identified in the participants in the English focus group with those in the Spanish focus groups. In the English focus group, individuals appreciated having telehealth as an option to get the healthcare. They discussed delaying appointments as well as healthcare because of COVID. There was an appreciation for the green space. They got information from physicians, the hospital, or community newsletters. They appreciated good educational opportunities, and they thought the community's strengths were the smart farm, garden plots, park districts, pool, and ball fields. In the Spanish focus group, individuals felt that telehealth was not the same as an in-person physician appointment. They were frustrated that they couldn't get appointments when they needed it or as quickly as they needed it. They saw a lot of green space, but they felt there was nothing to do there. It was just green space, so you needed some amenities. They would like to see improvement in nutrition, healthy food access, and groceries, especially at the schools. They were concerned about youth access to drugs. They got information from Google, Facebook, and YouTube, so they were using the internet a lot. The community strengths identified by these individuals was family, God and church, the Latino community, mental health support groups, the giving day of clothes, jackets, food, and boots. So there was clearly a difference in issues that were identified. Okay. So we also wanted to look at the differences and perspectives around COVID. So participants in the English focus group felt that the whole response to COVID was choppy and chaotic at first, that pharmacies and the national effort made things smoother once the vaccine came out. So they felt that the release of the vaccine sort of settled things down and it became smoother. A couple of the individuals said that they were shocked that the hospital was completely full at times, and they were not aware of this when it was happening. They felt fortunate to have access to testing, vaccines, and care. And that comment is from an individual in the English focus group who said, I have no idea because we just weren't that close to it, that there were times in January or maybe December where there were really no beds available in Good Shepherd. So I was shocked by that. It's kind of hard to imagine that we didn't have anything, any resources, and that a lot of seniors were not getting care or having to put up procedures and things because there was no space. In the Spanish focus group, they felt that the vaccine was developed so quickly. There was a lack of credibility in the vaccine that stopped things from happening well, that misinformation from doctors, sometimes even from doctors, created panic and chaos. As a community, it made them question the vaccine. They were concerned about the lack of availability of masks and the fear and anxiety of health problems, especially lungs, after having COVID. And the comment from one of the participants in the Spanish focus group said when the vaccine came out, but for some of us, it seemed it was very fast to have come up with the vaccine. It could have been the lack of credibility in the vaccine that stopped them some things as well. So again, differences in perspectives around COVID. Then in terms of resources needed, in the Spanish focus group, individuals talked about low-cost recreational services, more information in the Spanish language, but also more culturally accessible health information, information about health insurance, health resources, and other payment options, more support paying for specialty health care, because they felt that most people in their community were hired in jobs that were part-time that did not give them insurance. More indoor activities, especially in the winter, more developed parks in Carpentersville, walking paths, and so on. Motivation and education on need for physical activities to involve schools in the effort and to involve families in the effort. Bike trails for children and the ability to rent bikes. Better publicizing of culturally accessible ways on recreation. And they were concerned about, they wanted resources around bullying in school, racism in general, and the effect on physical, emotional, and psychological health. And that comment there talks about how having bike trails, but having accessibility for people to be able to rent bikes because affordability is an issue. I will now move on to the business leader focus group. The purpose behind the business leader focus group is to understand how the COVID-19 pandemic impacted local businesses. So we got some information on the leaders' perspective on overall health of the Barrington area business community, issues affecting the community, resources and strategies that help them cope and survive with the pandemic, resources that are still needed, and the greatest challenges and barriers to success. The business leader focus group, the significant issues that impacted the businesses during COVID-19, said that the ability to pivot, to be adaptable and flexible is what helped them cope and survive. Staffing, cost, supply chain issues, safety, and personal connections were the other issues that they brought up. And the comment was that we've all had to adapt digitally in some way or the other, whether it's selling services online or providing a vessel for your clients to do business online. Even like this, the ability to meet virtually via Zoom, as we are doing today, was something that enabled them to survive the pandemic. When we asked about future needs, going forward, they said the businesses were concerned about finding staff and the increasing unemployment, inflation, the rising prices from wages to supplies, making sure everybody feels safe, mental health and personal connections, and maintaining the same level of customer service. Some of the comments were like, if you're not treating our customers better than we did yesterday, we're going to fall behind. And so you have to do all that and at the same time provide exceptional customer service. Another individual said the big challenge is to make sure in my role everybody feels safe, making sure everybody feels heard, and making sure we can continue to be flexible in the months and years going forward, because I think that is our advantage in retaining staff. So that was all the focus group findings. Moving on to the not-for-profit survey, which was another piece that was new in this year's, in this round of the Healthier Barrington study. Again, to understand the impact of the pandemic on not-for-profits. The purpose was to understand the impact and to gain information from not-for-profit organizations on how the projections for the future and for 2022 and forward. We developed an online survey that was based on another statewide survey that was done with not-for-profit organizations. The survey was completed between January and February of 2022. 46 not-for-profits in the region responded, and full survey completion for 50% of the respondents. The not-for-profits that responded served the following 4 counties: Cook, Lake, McHenry, and Kane, and there were a few others counties mentioned. The top areas of service were human services, health and healthcare, and education. The survey highlights were that COVID-19 had a high impact on the Barrington area not-for-profits. That is 53.6% of the not-for-profits said that it impacted their services and that it continues to have an impact on their organizations. They reported an increase in demand for services since the beginning of the pandemic, and they anticipate that increased demand to continue. The impacts experienced by the non-for-profits were they had to cancel programs and services. They had increased and sustained staff and volunteer absences. There was a disruption of services to clients as well as the community, and there were budgetary implications related to the strain on the economy. The most impacted revenue streams during the COVID-19 was special event revenue went down, fees for service and earned revenue was impacted. Revenue from corporate grants and sponsorships was also impacted, and individual giving was impacted. So in general, their revenue streams reduced. They don't anticipate revenue streams to be strongly impacted going forward. They felt like, at least at the time that we did this survey, that things were bouncing back, and they anticipated higher giving. The 3 top needs that were identified were funding sources, staffing, and COVID-19 information and guidance going forward as the pandemic waxed and waned and there were changes and new variants, etc. So that's the survey highlights from the not-for-profit survey. So we did a really quick overview of the Barrington, Healthier Barrington study. And so now we're open to take any questions from the audience. And I haven't looked at the chat, so I don't know if there are questions in the chat as yet.
So this is Sam, and I did get a couple. Why don't we do this, unless you think you might want to refer back to something? Why don't we stop sharing for now?
Sure.
And I will add myself back in there. And I think Keely too. So a couple of quick points I want to touch on. So you mentioned, you talked about financial abuse. Can you define what that is specifically?
Give me a second and I'll pull up the question. I think it was predatory financial practices. Give me 1 second to pull up the survey so I can read the question verbatim to you.
Sorry to pull out a tough one right at the beginning.
No, that's okay. I should have had the survey open. I didn't.
I'm pulling up too, so.
Okay. So. You can ask the next question in the meanwhile. I'll find the question. Sorry.
The
That's okay.
survey
It's okay.
27 pages long, so that.
Yeah, that 28 minutes it took everybody to fill it out. I get it. We have a question from someone in the audience, and kind of one that I have as a librarian and specifically as a community engagement librarian. So the question from someone in the audience is someone who is also affiliated with a nonprofit, Be Strong Together. So the first paragraph is kind of an explanation. Be Strong Together delivers community program that educates, supports, and encourages mental health and well-being in children and families. Any recommendations on how to best deliver these goods on a community level, or other resources that speak to it, and any specific suggestions for equipping the community with the skills to better manage differences of opinion, viewpoints, and decrease intolerance of others? Maybe not.
It's a very
That's a tough question.
question.
What I will tell you from being at the university, what the university is doing to facilitate this. So I think what we are doing is, I am a faculty in a medical school. So with our medical students, we're actually doing a curriculum that teaches them how to communicate. So how to have a conversation. It's intergroup dialogue is what we call it, to have a conversation with very absolutely opposing viewpoints, but to be able to sit in a room and talk about it without it, blowing up in your face. So to teach people to recognize that everybody has a valid position. It may not be valid to me, but it's valid to them, and to try to understand where it's coming from. I think it's hard to do at a community level, but I think there have been some events that I heard about in the Barrington community where they've talked about intergroup dialogue and talked about how to discuss differing opinions in a productive way. I think rather than people going into their corners and saying my corner is the right corner, to discuss opinions and come from it. So I am not, this is not my area of expertise. I couldn't tell you how to do it in a community, but that's how we are doing it at the universities, trying to get students to talk to each other in a respectful manner.
And I do want to add that the Healthier Barrington Coalition, we are going to be meeting next month to go over the results and go over reactions of the study from the community. And Rafael Malpica, who chairs the coalition, and he is at Advocate Good Shepherd Hospital, we have written down on the agenda this exact type question to kind of go over and see what the coalition thinks.
Okay.
But that is a very difficult question to answer, but we will be discussing it as a coalition and hopefully as a community after that.
Okay.
And I would just add too, I do think, one of the things that was impressive this time was having the viewpoints heard of businesses, nonprofits, and community residents of, a broad range. And I think it sort of kind of opens the door for all of those different segments to be involved in addressing. So it's not just a community solution, but it's individual businesses, individual nonprofits in their own organization or own business that also can have the opportunity to, do some of those same kinds of trainings. I know I can just speak for Advocate Aurora Health. We have put those kinds of trainings and open conversations with each other as employees. We actually have hosted or moderated conversations around difficult topics, and they're working very well. They sometimes are, very heated, but we are very, the ground rules are you listen, you have your turn to share your opinion, but you absolutely respect and listen to the opinion of other people in the room. And I personally participate in at least two and find them just really eye-opening. And so as a business, that also can be an opportunity.
I think we do need to start with our youth and our children, because I think, you need to teach them that tolerance. And the ability to respect differing viewpoints. I see somebody's hand up, but I also found my questions. What do you want me to do first?
Sam Oliver was one of the Healthier Barrington Coalition members, so I'm going to make an exception and invite her to unmute
Sure.
to pose her question.
Okay, my question is just this. Before we end the evening, could we go back to the very first slide where we see what people value about, and it was a one slide. So don't refer to that now. I would just like to see that before we close this evening. So let's go back to the current question.
Barrington, is that the question you had? The reason for living in Barrington?
Yes, the reason that people want to live here.
Yeah, but I do think we
But
have go ahead, I'm sorry.
You have a previous question, so that's fine.
Can I jump off of Sam's and tying it to what we were just discussing? I think Sam, correct me if I'm wrong, but what you're trying to get at is if you start with what people want and then work backwards, find where you meet and agree on something, then it's easier to have a discussion. And when you do that out, not on Facebook, not on a social media platform where the emotions don't get tied to it, or the lack of emotion doesn't get tied to it, and the ability to explain yourself isn't there, you're more likely to have a conversation as opposed to a back and forth. So having those conversations where people can come together and meet and actually have a conversation as opposed to a typing keyboard battle can sometimes lead to better discussions, I think.
Sure.
I am gonna do a quick plug in here for if the folks on the call are not already familiar with Courageous Community, Courageous Conversations has been meeting for a couple of years now and kind of trying to talk about how do you have difficult conversations. Typically meets on the second Wednesday of the month at Barrington's White House. October will be starting up again in December on second Wednesdays. There is an event on November 1st that is part of that. If you go to courageouscommunity.us, you can find more information about that. If you look at the events tab, there's a link there to get tickets. The group started in 2019 and then went virtual, as did the rest of the world, and is now available in a hybrid format, both in person at Barrington's White House or via Zoom. So, which is a nice option to have. So I'm going to address one question that came up. Where and when is the recording of the survey available? This will be posted to the library's YouTube channel, and I will send an email to everyone who is registered when it goes live on YouTube. They've also graciously agreed to share their slides. So I will provide a link to that. I will do my best to get it done late tonight, early tomorrow morning, but I have a Library Association conference starting tomorrow very early in the morning. And if you work with videos at all, you know they take a long time to download and upload and all those good things. The same person also asked, and I'm not sure what you're referring to here, but what are the apps you mentioned? Are they specific to this survey? And I don't know if either of you know what that might be in reference to. I'm not sure.
Are they referring to supportive activities and supportive educational programs?
It says apps.
Apps, I don't know.
So if I could ask the questionnaire to clarify that a little bit, I'm not sure what you're referring to with that. Did
In
we,
the meanwhile, Sam, I think I'm sharing the screen with the slide on the reasons for living in Barrington, am I?
yes, you
Yes,
are.
you are.
Yes.
Thank you.
I love Zoom because I have no idea what it's sharing.
Yeah,
So that's the slide. And so if, to go through it, 66% of people who responded said abundant natural resources and open space, followed by 61% who said the good schools, 58% said safe neighborhoods, 47% said family, proximity to Chicago was about a third, 19% said jobs, and 9% said never thought of living anywhere else. There's 11% that said other, and I could, if you're interested, send you what that other encompassed.
Yes, that would be, thank you.
And I think it is in the full report, we have a listing of all the other responses. But what I will do now is go back to that initial question about what does financial abuse mean? And so the question was, select from the following list situations which you or someone in your household has experienced in the past year to the best of your knowledge, and select all that apply. So it was emotionally abused. I should actually just share my screen. And it's emotional abuse, which was intimidation, coercion, isolation, threatened, or degraded. Financial abuse is your money or your assets were used without your permission. So like I said, it was predatory financial practices. Physical abuse, hit, slapped, kicked, or physically hurt. And sexual abuse was forced to have sexual activities. And then there was an option for nobody was experienced any of these in my household. So that, to answer your question, that was the question. And that's how we defined it.
okay. So that might be situations like somebody being scammed, or it might be situations like someone in your household
Right.
accessing things and using them without permission, or I
Right.
suppose potentially withholding
Yes.
money.
And I know there are nuances to this, but we were trying very hard to make the survey short. I don't know that we succeeded, but we had to sort of make choices at every point. So.
And this is where organizations within Barrington can look at the responses and say, we need to do some more in-depth questions on this category, and they could do a follow-up survey that focuses solely on just one area.
Okay. And for the app question, I think they might be referring to something that's coming directly from Zoom. That Zoom was sending them a message that they could, do something in that.
Okay.
So, and let's see, couple other things. Again, it kind of goes along with the Be Strong question about how do you get information out to people. Just listening to some of the things that people were experiencing difficulties with. I know that there are resources through the county, through other things that can help with those, like utility shut off, like respite care, like household help and things like that. So it's, how do we make sure people know about those things? Know how
Yeah,
to,
and that's something that the coalition can look at, is making sure that an awareness campaign for resources. Jeannie and I have both been part of those campaigns in both McHenry and Lake County, where it's just the resources are there, people just don't know about them. So we might need to figure out how to raise awareness of existing resources in the community.
okay, thank you very much. I'm going to, it looks like we have addressed most of the questions. So a couple quick points I want to go over, and then I will turn things over to Keely to close us out. One is, and I'm going to only embarrass her a little bit, But Keely, the library has done a TEDx presentation for the last 6-7 years or so. And Keely will be one of our speakers this year. So we're very excited about that. And I urge all of you to register. It will be October 27th at 7 p.m. in the evening. And before we disband the meeting, I will put a link to register for that. I'll just send a link to the library's calendar, because the other thing that I wanted to talk about, one of the things that really shocked me was the number of people who have considered suicide. And especially, I think in the past, when we've talked about suicide, it's been seen largely as a problem of adolescence, but that wasn't where you saw most of it, right? So, so in conjunction with Be Strong Together and a presenter from Ascension, Illinois, the Behavioral Health Center, we are doing a program called QPR, Question, Persuade, Refer, that is a suicide prevention program that will be on November 2nd via Zoom. So, and the joke in my department is that as a community engagement librarian, a lot of the programs I do are the programs that someday you'll wish you would have come to my program, that something is going to come up and you're going to wish you had this information. So,
We have that problem in public health as well. We
yes.
should.
Yeah. Yeah. So just, just come learn about it and tuck it away. And yeah.
It's an excellent program, Sam. I think Keely and I have both gone through it actually.
Yes.
And it gives you a lot of really good tips and approaches. So I would highly recommend it.
And
I've
then
been-
Sam, just as a quick, as Jeannie was saying, the Lake County Health Department now has QPR trainers that are Spanish speaking. So if you ever have anyone that's interested in that, the Lake County Health Department now has them in place.
I will
have
share
that resource
information as well.
Well, as mental health first aid trainers too.
Yes.
Mhm.
And I have one other question. Would the library hold these resources for the community? And in fact, we do. Not every single thing we've talked about, but quite a few of them. If you go to the library, it's balibrary.org/community. That's kind of my page. And I update there's some things that are always there and available. But I update, like right now I have how to get voting information highlighted on there. But you can also reach out to me. My email address is on there. It's sadams@balibrary.org. And just because I work with so many nonprofits, I know if I don't know the answer, I know who to send you to. And if I don't know who to send you to, I know who to ask to find out who can help you with things. So, that's part of the library's role, is to connect you to the information and resources you need, whether it's a beach read or, how do I get help for my aging mother, whatever it may be. That's what we're here for. So those are all of my things. I will hand it over to Keely, and I am going to take Jeannie and myself off the screen.
I just wanted to say thank you to a couple people, starting with, of course, Manu and Christine. Thank you so much for all your hard work. I know this study required countless hours and meetings and us bothering you, and we just appreciate it so much. This study is really important to the Barrington community. There's not a lot of studies like it that you'll find. And the non-for-profits, they look at it so much, and it's so helpful for their programming and their grant writing. And so we just appreciate all the work that you guys put into it, and your research team. So please, anyone who isn't here who worked on it, please let them know how grateful we are. I also just wanted to thank thank you. I wanted to also thank the Healthier Barrington Coalition, all of the members on it who take time out of their workday. We built the survey, and they were on committees, and they did promotion and designing, and we would not have had the study without them. So thank you so much to all of our members on the coalition who devote time to the study. And then I also just wanted to thank any community member who filled out the study, who sat there for 28 minutes and answered the questions. Your voice is so important to us and all of the non-for-profits. And I just want to thank you so much for that time. So that is it, unless anyone has anything else.
I think we are all set. We threw a couple things up, and I will be, as I said, I'll share the link to the recording and to the slides as well, so people can peruse those a little more thoroughly. Thank you all very much. I really appreciate your time and attention tonight.
Thank you.
You.
Thank you.
You're getting, yeah, lots of thank yous in the chat, so thank you.
Thank you.
Thanks. Bye-bye.
Bye.